Hi guys, my name's Dr. Sarah Tonks. I'm a cosmetic physician. I work in London. I'm here today to talk to you about another serious topic. I know, right? We just had one last week. If I'm getting a bit too serious, then you guys definitely have to let me know, okay? This week, I am going to be talking all about how you pick your injector. And that's something which I'm often asked by people who maybe are in different countries or from Mars. No. When people are thinking about having injections done, maybe for the first time, there are three questions which are asked. The first is, how much does it cost? The second is, does it hurt? And the third is, will it look natural? For me, I think those questions are probably not the right ones that you should be asking because they can all be managed. If you have the right injector for you, don't worry about whether or not it's painful. Don't worry about whether or not it's going to look natural because it should do. The question that you should really be asking yourselves is it safe? A few months ago, I did a video with a good friend of mine, Nadine Bagot, and we did a video all about how you should pick your aesthetic injector. We will make a link to that in the section below. And she asked me some really insightful questions, which patients often ask, and I'm going to just run through those again, maybe give a little bit more detail to you guys. The first thing that she asked me was, who should be injecting? I don't know about where you guys live, but certainly in the UK, we have an awful lot of people who aren't clinically qualified who are performing dermal filler injections. And that's because here at least, dermal fillers are classified as a medical device, not as a drug, which would make them a little bit harder to get hold of. You may have seen me talking last week about potential complications which can occur after you've had a dermal filler. Which is kind of weird actually, because it's a lot easier for people to obtain and inject dermal fillers themselves than it is to get hold of Botox. So I always find that a little bit incongruent. But anyway, that's the situation over here. And as I said, in the UK, it's quite common for people who are not clinicians, that's doctors, dentists and nurses, to be doing these injections. In my opinion, if I was going to have a procedure done, I would definitely want to go to somebody who I knew would be able to appropriately manage any complications should they arise, and also have the anatomical knowledge and clinical knowledge to be able to avoid the vast majority of those complications from happening in the first place. Just as I wouldn't have a crack at cutting someone's hair because I don't have the appropriate experience to do so, I would really not suggest that you maybe go to your hairdresser or just some random person in the street to have a product injected into your face. I mean, come on guys, think about it. It doesn't make any sense. I would also want to know how many times that person has done that particular procedure. The results that you get are not going to be the same if you're, say, the first person that they've ever treated, as opposed to somebody who has treated maybe 500, 1,000 cases in the same way beforehand. A lot of people, particularly in aesthetics, so doing procedures like Botox and fillers, they will just kind of dabble in it a little bit, and it really depends what you want from your result. Say you've got your wedding coming up and you need to find a makeup artist to do your wedding makeup. You're going to pick someone whom you haven't seen their work before, they've never done a wedding before, and you're not going to have a trial of that makeup. Probably not. So why would you do that for an injection which is going into your face? Oh, and the best part about it is they're actually not even a makeup artist. The third thing, which I think is really super important, is that you know what product is being injected into your skin. There are some amazing products out there which have got a brilliant proven track history of safety. They're pharmaceuticals or pharmaceutical grade, and they're ones which I would personally choose to have injected. Likewise, there are products out there which are really, really not so good, which maybe have got a little bit of a sketchy safety profile, things which I definitely would not choose to have injected into myself. So again, you've got to think to yourself, which one of these two products do I want to have put in? Do I want to have the one which is known about and trusted? Maybe it's a little bit more expensive, but that's why. Or am I going to save a few quid and have slightly cheaper product injected that has less of a great safety profile? I'm not going to say that it's not safe, but maybe it's got a few more complications associated with it. Of course, you're going to pick this one, right? And of course, you should know what's been injected into your face. It's your face, after all. You know what girls are like. We know like the number of the makeup brush that we're going to be using, or like what's the best base to use for this particular skin type. Like, you should really know what is going to be going into your face and take ownership of that. Because what if you go to a different clinic and then the next person asks you, okay, great, what did you have done before? And then you don't know, and it kind of kicks off this whole circle of doubt. So definitely, when you're having something done, make a note, put it in your phone, or take a picture of the box or something like that, so that at least you've got a record of what injections you've had done. You should definitely have a conversation as well about the side effects that could potentially happen after you have this treatment done. Anybody who says that there are no side effects, you should definitely 100% run a mile out of there, because it's just not true. Like I keep alluding to, you should definitely feel confident in their ability to be able to manage that particular side effect should it occur. Ideally as well, you should have a follow-up appointment available to you at least. In all likelihood, you wouldn't need it, but you don't want to feel like your injector is going to leave you high and dry if the worst comes to the worst and you do have a question, a query, or something occurs. Definitely don't be scared to ask questions when you go in for your appointment. I love it when people ask me questions. The deeper, more probing and searching, the better. Because, to be honest, it gives me the opportunity to show off a bit. And who doesn't like doing that? I think good ways to find out who might be a good fit for you injector-wise is maybe to speak to your friends. See who they have used in the past and if they were happy with their treatment. Of course, it's a little bit difficult if your friends are not happy to talk about having these procedures done, which I think is why we should really be a lot more open and honest about it, because it shouldn't be this kind of shameful thing that you hide away. You should be able to discuss these things with your friends. Why as women are we always attacking each other for this? I think it's really interesting. Do you know what my actual top tip is when you're picking your injector? My number one, the most important thing that you can look for if you're looking for a nice natural result and you're not too sure where to get it from, is to speak to them about proportions and about beauty, because then you'll have an idea of whether or not that person knows what they're talking about. If they've just gone on some random course and maybe they've done a few lips, they've done a few cheeks, maybe they've done some nose to mouth lines, doesn't mean that they understand the proportions of the face, the golden ratio, the phi ratio. I know, weirdly enough, that's becoming a little bit untrendy right now, but you have to know the rules before you can break them. So see what they're doing in their practice. Are they using imaging software to have a look at the two sides of the face? Are they measuring you up appropriately to see where you can be taken a little bit closer to that idea of golden proportion? Do they have this discussion with you? I think that's probably the best way that you can identify the difference between somebody who's competent to inject and actually really, really good at injecting. There are various different methods that you can use to measure up someone's face, and sometimes, especially on Instagram, they're kind of like waved a little bit in front of the patient, like, ooh, look, ooh, waving some science over the patient. Yeah, and it, to me, to the injector, it just doesn't make any sense what they're doing. But at least it's a good indicator that they at least know what they should be doing. So I think you're probably safe with that group of people. You know what, guys? I'd also want to look at the way that they look at me as a whole person, like holistically. So is it a bit of a conveyor belt? Are people in and out quickly? Or does that person really take the time to sit down with me, find out what my goals and aspirations are, and what my motivation is for seeking treatment? Because it's only by understanding why somebody is sat in front of me in the first place that I can truly make a bespoke plan for them. Is it because they're dating for the first time in a long time? Is it because they want to look more corporate at work? Is it because they want to look less tired? All that emotional stuff is actually really, really important in the way that I would treat that person. So maybe see how they look at you as a person instead of just doing whatever treatment it is that you come in asking for. If I'd just given them the treatment that they asked for, they wouldn't get the outcome that they wanted. So say, for example, I don't know, they asked for a tear trough treatment, which is something that I actually despise doing. What they're actually asking me most of the time is, how can I look less tired? So tiredness is not just conveyed by the depth of the tear trough, it's conveyed by the position of the eyebrow, by the tilt at the lateral part of the eye, by the colour of the skin around the eye, by the quality of the skin around the eye, by the position of the upper eyelid. And it's only by understanding what it is that that person wants that I can really give them that. It's not going to help if I inject the tear trough. It won't necessarily make them look less tired. And that's the difference, guys. That's the difference between, as I said, someone who's competent to inject and someone who's good at it. And it's up to you to decide whether this person which is sat in front of you, are you going to let them near you or not? Do they meet your expectations or not? Ultimately, you're the only one who can decide what is important to you. Is it going to be price, which is a motivator? Is it going to be because, I don't know, maybe the Instagram pictures before and after were great? Is it going to be because they were close to you and it was convenient? Or is it going to be something else, like the way that they make you feel, or the fact that they listened to you and took the time to appreciate really what it was that you wanted? And you know, I can't answer that question for you. Only you can answer that for yourselves. Okay guys, so that's it for this week. Another heavy topic. Oh my god, I need to do something like light and airy next week. Anyway, I hope that you enjoyed the video. If you have any further questions or comments, please just let me know below and I'll definitely answer them for you. In the meantime, if you've enjoyed the video, don't forget to hit that like button, and if you haven't subscribed to the channel, then please, please, please do so, because otherwise you might miss a video. I'll see you later.
You're looking like a movie star, but I know just what you are. Seems like you're type to be on the floor. You're looking for a kind of queen, the baddest one you've ever seen.